Welcome to Integrated Counseling and Wellness's resource page. This video is a brief explanation describing what the Herbs for Depression and Herbs for Anxiety mini references are and how to use them. The Herbs for Depression mini references, as well as the Anxiety mini reference, were created through a research process that involved creating a consensus among some of the nation's top clinical herbalists. And we've identified through that process a number of herbs that have a strong consensus to being used to complement the treatment of anxiety and or depression, or in some cases, if under the direction of your physician, can be used instead of medication. The resources created for professionals, especially allied healthcare professionals, to be able to help their patients integrate herbs into their treatment plans and communicate the clients or the patient's preferences for herbs to their physicians. It does so by providing some questions and some facts about herbs, as well as providing a synopsis of the safety of the herb, the research behind it, contraindications for the herb, as well as just general warnings. So a couple things to know, regardless of whether you're a professional working with clients or if you're a patient who's looking into using herbs to complement the treatment of depression and or anxiety, is that the research indicates, and the references are on here too, that patients who choose to use herbs frequently do so because of deeply held healing beliefs. And that's really important, especially for those of us who are involved in psychotherapy and patient-centered care. Herbs can create clinically significant outcomes in patients suffering from mental and emotional issues. Now, clinical significant outcomes can be positive and negative, and herbs have been shown to be able to do both, and some herbs more than others. Herbs can create clinically significant negative side effects if taken in improper doses or if contraindications are not identified. And this is one of the reasons why we as healthcare professionals, as allied professionals, we have patients who will tell us things that frequently they don't tell their physicians, and which is mentioned later on in this bullet point. But we have an opportunity to be able to help communicate those things to physicians, to their psychiatrists or their nurse practitioners or PAs, to make sure that these herbs are not interacting with medications in a negative way. Drug-herb interactions exist, and potential interactions are a primary concern when patients use medications and herbs simultaneously. Research indicates that patients' compliance to medication frequently increases when herbs are taken at the same time. So just because herbs may interact with the medication doesn't mean that they shouldn't take the herb or they shouldn't take the medication, right? It just needs to be done in an integrative way above board so everybody knows, because the compliance with medication treatment actually increases. And I think, we don't know because the research doesn't really say, but my thoughts on that is that because they do it, the compliance goes up because the patient then feels like they're doing everything that they can. And at the same time, they're still able to abide by their healing beliefs in some way, especially those who aren't that excited about taking a medication. Research has found that 47% of patients select herbs based on information obtained from the television, radio, internet, or family and friends. You know, here we are, and I'm posting this on the internet, and so this goes within that. But my hope is that you as a professional or you as a patient will actually download and print this off and take it. If you're a patient, take it into your healthcare provider to be able to talk about these, about the herbs that you're using or that you're interested in using and how they may affect your medication or other conditions that you may have. If you're a healthcare professional, my hope is that you'll use it and as a means of creating a discussion with your patients, because there's a decent chance that they are taking an herb or some sort of supplement to be able to help them with anxiety and depression. Outside of a few popular herbs, Western trained physicians are rarely educated on the benefits and the risks of the herbs. So this mini reference actually has a lot of information that some physicians are really familiar with, and other physicians, they're not really that familiar with it. But that doesn't mean that it's not helpful. It also doesn't mean that it can be harmful depending on what other issues the patient has going on. Patients frequently, now this is important, this is one of the reasons why the mini reference was created. Patients frequently do not report their use of herbs to physicians because, one, patients sense that physicians do not have enough time to consider and integrate herbs into their treatment plan. Two, patients assume that because herbs are natural, they are therefore safe and have no need to report them to their physician. And three, patients fear being criticized by their physicians for taking herbs and subsequently being told to stop using them. Many of you have probably experienced this either on your own, for yourself, or with their patients. Part of that is just because it's the nature of the way that our healthcare system is set up. But it's in this mini reference, I hope that you'll use it to be able to push back on this a little bit, to be able, again, to create discussion between the client or the patient and their physician, whether they're in your clinic or not. Here's just some instructions on how to use it. And I'm not going to actually read through this, but I would encourage you, if you're a healthcare professional, to read through and figure out how to use it. Now let me show you how the reference is set up. When you get to the herbs that are included in the reference, in this case the Depression Quick reference, you'll be able to see it's basically a table of contents, which herbs are included. And you want to make sure that you're checking both the common name as well as the scientific name, because sometimes the common name, like an herb, may have multiple names, multiple common names. And so make sure that you're talking about the correct herb. Now each herb is organized by a class of evidence. You can see here the definition of each class. So herbs with class 1 evidence are herbs that have at least one properly designed randomized controlled trial for the use, in this case, of depression. These are those herbs that fall in that category. So if you want to look at those herbs, go to the table of contents, find what page they are, and then you can go down and view the information about it. Class 2 evidence are herbs that have at least one controlled trial without randomization, or are well-designed cohort or case control analytic study. Pharmacological, in vitro, or in vivo evidence are present. So that's our second class, and the class 3 is it's still an important class of evidence, because herbs don't get the funding to be able to research in the way that medications do. And frankly, the way that herbs work doesn't lend well to the Western model of research. And so herbs with class 3 evidence for depression are the opinions of respected authorities, clinical experience of expert committees, and in this case, expert clinical herbalists. So again, you just go, once you find the herbs that you're looking for, you go to the table of contents, and it will tell you what page it's on. Now let me show you how to actually use it once you find the herb. So let's say, for example, let's look at this one. This is rose root. Okay, rhodiola. So rose root is on page 2, and we would go down to page 2, and hopefully it's here. There it is. Okay, I'm going to I'm going to cruise back up here to show you what this all means. So next to the name of the herb, you'll find a subscript with a number next to it, and that's the number of randomized controlled trials supporting its use, in this case for depression. The same thing would be in anxiety, in the anxiety reference. There's also a subscript term, whether it's an antidepressant or anxiolytic, that indicates the primary use or the action of the herb, because some of these herbs are not specifically used as an antidepressant, but they're a supportive herb that helps the entire body, the entire system of the individual. So not all of them are antidepressant, and it's important to understand that. The safety rating is the rating that was provided by the panel of master herbalists. In this case, it's considered generally safe. Drug interactions or drug-herb interactions, this is a very important. Both of these are important, and they are just essentially what they say. The support that the clinical herbalists provided for this is mentioned in this column, and in this case it's quite weak, but there is research indicating that it is helpful. And so I'm not here to say that who's wrong or right in this, but it's good to give context to be able to. With this, we essentially know that because of modern research, roseroot has antidepressant properties, and that there's research that indicates that it can have a clinically significant effect. But this herb hasn't been used historically, at least according to this cohort of master clinical herbalists, it hasn't been used historically for this purpose. It can at times, maybe it probably was at times historically, but generally speaking, that it's not used traditionally as an antidepressant. And then you get the comments, and the comments provide context from these master herbalists in addition to the research, and that's something that the mini reference provides that most other references don't. This is a combination of comments by these master herbalists, and in this case, this herbs can cause insomnia in a significant number of people, heart palpitations in some, and can provoke mania in people who have bipolar disorder. Additionally, if this herb is used for its energizing effects, instead of the patient getting the requisite sleep needed to be well, it can support behaviors that lead to exhaustion. And just as a side note, I love this herb, but you do need to use it carefully, and these comments can help physicians or you as a patient to be able to have good conversation about how to use it. Recommended dose of these of each herb is also mentioned in the reference. So you can see that each of these, each herb has each of those components, and the same is true for the mini reference for anxiety. There's quite a bit of information in here. I'll continue to add to it as time permits. And here are also the references. I hope this is helpful, and good luck to you if you're a clinician supporting your clients in their client-centered care and integrative care. And if you're a patient, good luck to you with your wellness goals. And don't give up. There's lots of resources out there, and let us know if we can help. Thank you.